Difference between autocratic and democratic leadership style. Question 1. During a hospital staffing crisis in 2025, one nurse manager immediately assigns tasks without team discussion while another gathers staff input before acting. Which leadership insight best explains the long-term advantage of the second approach? Option A, faster rule enforcement. Option B, higher emotional distance. Option C, improved staff engagement and trust. Option D, reduced accountability. The correct answer is option C. Improved staff engagement and trust. Great leadership is not measured only by speed but by how deeply teams commit during pressure. Question 2. Why do many modern healthcare organizations prefer collaborative leadership during patient safety initiatives? Option A. It removes all conflict. Option B. It increases fear among workers. Option C. It encourages shared responsibility. Option D. It eliminates legal risks. The correct answer is option C. It encourages shared responsibility. Collaborative leadership strengthens accountability and improves vigilance across healthcare teams. Question 3. A newly promoted nurse supervisor notices staff morale falling under strict command-based leadership. Which hidden risk is most likely developing beneath the surface? Option A, faster communication. Option B, reduced creativity and silent resentment. Option C, improved innovation. Option D, lower turnover. The correct answer is option B. Reduced creativity and silent resentment. Rigid leadership can quietly damage morale and reduce innovation within healthcare teams. Question 4. What is the strongest advantage of democratic leadership during nursing shift changes? Option A, leaders avoid responsibility. Option B, staff become less accountable. Option C, team communication improves. Option D, rules become unnecessary. The correct answer is option C. Team communication improves. Strong communication during shift changes reduces errors and improves patient continuity of care. Question 5. A hospital director using highly authoritarian leadership notices rising staff turnover despite improved efficiency metrics. What lesson does this reveal about leadership in healthcare? Option A, efficiency alone sustains loyalty. Option B, fear creates long-term stability. Option C, human connection influences retention. Option D, strict control eliminates burnout. The correct answer is option C. Human connection influences retention. Healthcare professionals remain loyal where trust and emotional respect are present. Question 6. Which leadership style most encourages nurse innovation during staffing shortages? Option A, punitive leadership. Option B, collaborative leadership. Option C, detached leadership. Option D, passive leadership. The correct answer is option B. Collaborative leadership. Innovation grows where nurses feel psychologically safe sharing new ideas. Question 7. Why might younger nurses in 2025 resist purely autocratic leadership models? Option A. They dislike patient care. Option B. They expect inclusion and transparency. Option C. They prefer confusion. Option D. They avoid responsibility. The correct answer is option B. They expect inclusion and transparency. Modern healthcare workers value transparency, teamwork, and open communication. Question 8. A nurse manager asks staff to vote on a scheduling system before implementation. Which principle is demonstrated? Option A, fear-based compliance. Option B, shared decision-making. Option C, emotional detachment. Option D, punitive supervision. The correct answer is option B. Shared decision-making. Shared decision-making creates ownership and stronger workplace engagement. Question 9. What hidden weakness often exists in excessively autocratic healthcare environments? Option A, too much collaboration. Option B, delayed authority. Option C, suppressed communication during crises. Option D, excessive innovation. The correct answer is option C. Suppressed communication during crises. Fear-based environments often silence important safety concerns. Question 10. Which outcome is most associated with democratic nursing leadership during patient-centered care planning? Option A, reduced family involvement. Option B, stronger interdisciplinary teamwork. Option C, less accountability. Option D, lower patient satisfaction. The correct answer is option B. Stronger interdisciplinary teamwork. Collaborative care planning strengthens patient outcomes through shared expertise. Question 11. A nurse leader who constantly demands obedience without explanation may unintentionally damage which critical workplace factor? Option A, payroll systems. Option B, professional trust. Option C, building security. Option D, clinical terminology. The correct answer is option B. Professional trust. Trust weakens when leadership lacks transparency and emotional awareness. Question 12. Why is democratic leadership often linked to stronger problem solving in hospitals? Option A. It reduces all disagreements. Option B. It gathers multiple perspectives. Option C. It removes leadership authority. Option D. It limits communication. The correct answer is option B. It gathers multiple perspectives. Different healthcare perspectives often reveal safer and smarter solutions. Question 13. What leadership lesson became globally visible during healthcare crises in recent years? Option A, fear improves teamwork. Option B, communication shapes survival. Option C, silence prevents conflict. Option D, isolation improves morale. The correct answer is option B. Communication shapes survival. Clear communication stabilizes teams during uncertainty and crisis situations. Question 14. Which leadership style is more likely to encourage mentorship among nurses? Option A, democratic leadership. Option B, punitive leadership. Option C, rigid command leadership. Option D, detached supervision. The correct answer is option A. Democratic leadership. Mentorship thrives where leaders encourage learning and collaboration. Question 15. A healthcare organization notices increased medication errors after managers adopted aggressive command-only leadership. What is the most likely explanation? Option A, fear reduced communication and reporting. Option B, workers became too creative. Option C, meetings increased productivity. Option D, policies became too flexible. The correct answer is option A. Fear reduced communication and reporting. Fear discourages staff from speaking up about concerns and mistakes. Question 16. Why do democratic leaders often achieve stronger long-term workplace cultures? Option A. They avoid accountability. Option B. They increase emotional investment. Option C. They eliminate structure. Option D. They discourage discussion. The correct answer is option B. They increase emotional investment. Inclusive leadership strengthens emotional loyalty and organizational culture. Question 17. What is a major limitation of purely autocratic leadership during rapidly changing healthcare situations? Option A, too much flexibility. Option B, limited frontline feedback. Option C, excessive collaboration. Option D, higher emotional intelligence. The correct answer is option B. Limited frontline feedback. Healthcare leaders need frontline insights to adapt during fast-changing conditions. Question 18. A nurse manager regularly asks staff how policies affect bedside care before finalizing decisions. Which leadership quality does this reflect? Option A, control through intimidation. Option B, operational empathy. Option C, punitive supervision. Option D, detached efficiency. The correct answer is option B. Operational empathy. Operational empathy connects leadership decisions to real patient care experiences. Question 19. Which statement best reflects the psychological strength of democratic leadership? Option A. People support what they help create. Option B, fear ensures permanent loyalty. Option C, strict rules eliminate stress. Option D, authority alone inspires innovation. The correct answer is option A. People support what they help create. Workers commit more deeply to systems they help shape. Question 20. Why might autocratic leadership still be useful during certain healthcare emergencies? Option A. It allows faster decisive action. Option B. It removes patient needs. Option C. It discourages teamwork. Option D. It reduces accountability. The correct answer is option A. It allows faster decisive action. During emergencies, rapid clear direction can save lives. Question 21. What leadership balance is most effective in modern nursing management? Option A, permanent strict control. Option B, complete absence of authority. Option C, adaptive leadership based on situation. Option D, ignoring emotional dynamics. The correct answer is option C. Adaptive leadership based on situation. Effective leaders adapt styles depending on team needs and clinical urgency. Question 22. A democratic nurse leader notices quieter staff rarely speak during meetings. What should the leader do next? Option A, ignore the silence. Option B, encourage inclusive participation. Option C, punish non-participation. Option D, end collaboration entirely. The correct answer is option B. Encourage inclusive participation. Inclusive participation uncovers valuable insights hidden beneath silence. Question 23. What often separates respected leaders from feared leaders in healthcare? Option A, control over schedules. Option B, ability to inspire trust. Option C, punishment frequency. Option D, emotional distance. The correct answer is option B. Ability to inspire trust. Trust creates stronger loyalty and communication than fear ever can. Question 24. Why are emotional intelligence and democratic leadership increasingly connected in nursing management? Option A. Both discourage communication. Option B. Both prioritize human understanding. Option C. Both remove accountability. Option D. Both eliminate authority. The correct answer is option B. Both prioritize human understanding. Modern nursing leadership depends heavily on emotional awareness and empathy. Question 25. What is the greatest long-term danger of leadership built entirely on fear? Option A, temporary compliance. Option B, reduced emotional awareness. Option C, collapse of trust and engagement. Option D, faster short-term results. The correct answer is option C. Collapse of trust and engagement. Fear eventually destroys communication, trust, and long-term team resilience.